Welcome to COVID Conversations. A pandemic like COVID impacts people in so many different ways, and today's conversation is going to be looking at some of those impacts. First, I'm going to speak to Hollie Wilson and Jeff Buckley. They work supporting people who are facing challenges with drug and alcohol use. We all know that emergencies, pandemics, crises, disasters impact vulnerable people, and you're directly at the point where you see those impacts. What have you seen?
Look, a lot more people have been presenting in crisis over this time. There's a lot more sort of complexity. Certainly in our phone service, we've had a lot of people contacting us quite regularly, sort of as a response to some of the isolation they've felt during the COVID period. Often people don't seek help until it becomes problematic, but we're certainly seeing an increased demand for our services, and people who do use substances, particularly alcohol, are using them more.
And what is the support that you give?
So we provide 24/7 phone support to anyone in Queensland, specific support around alcohol and drugs, and information, and really just a compassionate, sort of non-judgmental sort of approach to that. And we can provide referrals into agencies, or just sort of targeting whatever the person needs where they're at.
It's quite fair to say there's a lot of stigma around substance use and drinking, and people often feel a lot of shame about what they take and consume, and they're not likely to come out or be very, open about it, and that's why we have lots of problems, because of that stigma. And I think it's letting people know that these services, won't treat you like that, and that they're here to help you, and they've seen it all before, and actually the earlier that you address those problems, the better chance you have of a better outcome.
There's work that can be done by GPs in this space.
Yeah, I think it's really important at this time that GPs or any health practitioner understand that people's substance use might have changed over the course of the last few months, and to make sure they ask about it. Are they drinking more? Are they smoking cannabis more if they smoke? And to ask that of everyone and not just assume or gloss over it, because a lot of people might not volunteer that information, but if asked by a GP or someone they trust, might say, yeah, actually I have been, and that could start up a conversation. We know there's greater evidence around the effectiveness of those brief interventions, those one-off chats, even for 5 minutes with a GP or health practitioner around this substance use. So every opportunity is an opportunity to have that brief intervention.
And Hollie, when people come to you on the phone, what's the best thing that you can do for them?
I think it's just to hear their story and to work out, a holistic picture of what's going on in their lives at the time, what's actually brought them to that point. So many people don't get to that point, so you really have to treat it quite gently, and just work with the person on what their particular goals are, knowing that that could be anything from sort of stopping their substance use right through to cutting back or just reducing the harms of it.
So it's not so much focused on the substance, but the human. Yeah. Okay.
There's some interesting observations just around the COVID period, around substance rates. The Global Drug Survey have done some results across the country. Now, this is a sample of people volunteering, and a lot of them would identify as already using substances. But some of those results kind of show that there's been an increase in cannabis use amongst existing cannabis smokers, increase in benzodiazepine use, big decreases in MDMA and cocaine use, which makes sense, people aren't going out as much. And the alcohol, possibly, it's a bit mixed, it's hard to tell, but you'd probably assume that some people are drinking more, but it's hard to tell because people aren't going out and drinking in pubs and clubs and licensed venues, they're drinking at home. And so people's patterns of drinking might have changed. And also, going back to that point around shame and stigma, a lot of people might have been drinking at quite high levels for a while, but now they're at home a lot more. That could increase their ability to drink, but also it's quite likely that other people are staying at home with them and have seen their drinking, and it's for the first time that they've said, hey, you drink maybe too much, which is making them call your service because they can't hide it as much as they used to.
And it's not just being at a party, I'm just a sociable person.
Yeah, so it's interesting, the changing in our movements and how we socialise is affecting how we can drink.
And how we see how we drink.
And exactly, and how other people see how we drink as well.
Thank you very much. Thank you both.
Yeah.
And we'll see you next time.